What are the types of neuroacanthocytosis? Neuroacanthocytosis is a term that describes a group of rare inherited disorders. These disorders are characterized by the presence of abnormally shaped red blood cells known as acanthocytes. They also involve progressive brain dysfunction. Symptoms can include movement abnormalities, cognitive decline, psychiatric symptoms, neuropathy, and in some cases, seizures. Let's explore the main types of neuroacanthocytosis. First, we have the core neuroacanthocytosis syndromes. The most recognized among these is Chorea-Acanthocytosis, often referred to as CHOC. This is an autosomal recessive disorder. It is marked by involuntary movements known as chorea, dystonia, cognitive decline, psychiatric symptoms, and, of course, acanthocytosis. Another important syndrome is McLeod Syndrome, which is X-linked. This disorder features movement disorders, muscle weakness, cardiomyopathy, and acanthocytosis. It shares many symptoms with CHOC but also includes blood group antigen abnormalities. Next, we have other neurodegenerative disorders that may show acanthocytosis but are primarily known for different features. One example is Huntington Disease-Like 2, or HDL2. This disorder resembles Huntington's disease and includes chorea and cognitive decline, but acanthocytosis is not consistently observed. Another is Pantothenate Kinase-Associated Neurodegeneration, or PCAN, which involves brain iron accumulation and can sometimes be associated with acanthocytosis. Abetalipoproteinemia is another rare disorder affecting iron metabolism, which may also show occasional acanthocytosis. Then, there are disorders with lipoprotein abnormalities that feature acanthocytosis. Abetalipoproteinemia is a rare inherited disorder that leads to fat malabsorption and neurological symptoms, along with acanthocytosis. Hypobetalipoproteinemia is similar but typically milder and also linked with acanthocytosis. Lastly, we have other rare syndromes like Bassen-Cornsweg disease, which is also known as Abetalipoproteinemia. This disorder is characterized by ataxia, retinitis pigmentosa, sensory loss, and acanthocytosis. In summary, the two most typical core neuroacanthocytosis syndromes are Chorea-Acanthocytosis and McLeod Syndrome. Other disorders like HDL2, PCAN, and those related to lipid metabolism may also present with acanthocytosis but are less central to this classification. When considering Parkinson's disease, it is crucial to recognize these neuroacanthocytosis syndromes in differential diagnosis. They can present with movement disorders such as chorea and dystonia, which may mimic or overlap with Parkinsonian symptoms. Understanding these types can help avoid misdiagnosis and guide appropriate genetic and clinical testing. Diagnosing neuroacanthocytosis syndromes involves looking at clinical features, examining blood smears for acanthocytes, checking elevated creatine kinase levels, and conducting genetic testing. Treatment remains symptomatic and supportive, highlighting the importance of accurate diagnosis to differentiate from Parkinson's disease and other movement disorders. Always consult healthcare professionals for personalized medical advice.